So while you're in this state, hmm, when you're watching television and the movies and other people that are sick, sometimes it doesn't feel like that thing is something, looking at it from the outside, until you're the one trapped inside the body that's not moving again. You're trying to talk. Have you seen people who have stroke when they're trying to talk? What they have is called dysarthria, inability to speak because of the muscles that coordinate speech. One half of it is off. So they're trying to get sounds out. You can't hear them. Some have aphasia. The brain is not even, the speech control center of the brain is completely off. They're looking at you like this. But there are words in their eyes. They're trying to tell you, carry me and go and do what Dr. Kendrick said. But at that point, you can no longer do it. Even if you want to use your phone that time and send the video, for them, you can't because your hand is like this. If you say that you use your left hand and send, they tell you, stay now, brother, stay, don't worry. Just stay, don't disturb yourself. They don't know you're trying to communicate something. They tell you, don't worry now, stay, pano. So we're trying to tell them they cannot. Now you're having mouth and two hands. You will not send this video to everybody that you know. So that when you have a medical emergency, they will be educated on what the correct thing to do early enough. A partial stroke is not a stroke that happened on one side. That's a stroke. That's a complete stroke. A partial stroke is sudden loss of function, series of correct things done, or spontaneous resolution, and then the function comes back to normal. That's a partial stroke. I had a stroke and it just disappeared within 24 hours. That's a partial stroke. But when you have a stroke, one side of your body goes, your face on that whole side goes. That's a stroke. There are a set of things you must do before 3 hours pass. If you know this thing I'm about to say alone, and you're the one who's having the stroke, you're going to suffer for not releasing the knowledge to your neighbor. Because it may not be your father that will be there. It may not be your wife. It may not even be your sibling. It may not be your friend. It may be your neighbor. It may even be a stranger. So you're supposed to share everywhere. You're supposed to throw the thing on your social media. Throw it there. Throw it on your... And see what I'm saying. I'm saying throw it to social media. When you throw it, them that saw it there will see me saying through. And they'll keep throwing and the video will keep going. That's what you do with medical information. You don't just watch it and be like, wow, this has changed my life. And you go to the next video. That's not what... This is education I'm doing. I'm going to... You want to save somebody's life. Let me not even say you. But you know what goes around. You know how it does. It's a set of things that must be done in 0 to 3 hour window for you to come back to what you used to be. And stroke is not just function that goes. Sometimes it's consciousness that goes. You're not even there. On somebody does it correct. So please, all I'm preaching is this. The understanding of what happens in stroke. I've taught this a couple of times. I'll not get tired of teaching it because some of you don't listen. Blood vessels carry blood. The heart is the reservoir. Is the tank. The pipes that leave the tank. They are the pipes that leave the tank. They are the blood vessels. Some of them are outside here. You can see them on your hand, on some slim person's hands, on their body veins. But the second one is under. They're not on the skin. They're on below the muscle. You can feel them. Here. You can feel them. Arteries. They're the ones that carry the blood out. So there's pressure inside them. That's why you feel them. These ones carry blood back. So there's no pressure in that one. But the ones that carry blood out, high pressure. So the heart is. And that's what you're seeing in the heart is actually it's contraction. Pumping out, in, out, in, out, in. Blood is going to go, come back, go, come back, go, come back. That's what blood should be doing. When blood is going and stop on the way, stroke. If it is the one that was going to the brain on this side, then this side will tell us. If it's the one that was going to the brain on this side, then this side will tell us. What makes blood go to the brain stop going to the brain because the pipe that was sending blood to the brain either started leaking because it broke or it blocked. I don't want to teach you how to stop it from happening. I'll do that later. But I want to tell you what to do when it happens to somebody so that the person can come back to what they used to be. And you will not even know they had a stroke, including you. And I'm telling you that if what I'm describing happens to you, it's not you that will decide what's happened to you. You can't move. It's somebody that will decide. If they waste time, you suffer for their time wasted. If you take the best decision, you enjoy the decision they made. So this is one of those videos that you don't keep for yourself. You should have shared this sense before you got to this point in the video. You should have shared the video with your whole contacts on your WhatsApp, everybody. Share with your social media, everybody. Post it on your page. Post. Then when you share this, share, everybody will hear it. So that everybody will be informed. When somebody has a motor problem where they suddenly lose it before 0 to 3 hours, because the person who has gotten the injury is the brain. Brain is not skin. Brain is not teeth. Brain is brain. You know what brain is. So you don't want time to be going. After 3 hours, it's not too much that can be done to bring back the person to what they used to be. I'm talking about really loss of consciousness. There are people who have had strokes and didn't wake up from sleep again. They kept sleep. They're not dead. They just sleep. Maybe morning. Because when they are sick, you can't know. When they have infection, you can't know. They are unconscious. So you keep them in the hospital and you keep paying. Money keeps going. So to save you all the money, just share. That's how you save yourself money. Just share. It doesn't take you anything. When the blood going to the brain, in one of the pipes, the arteries, gets blocked, blood does not reach where it's going to. That's called ischemic stroke. When the blood, the pipe carrying blood to the brain, any side, gets broken, the blood will not reach there again. So still, that's called hemorrhagic stroke. The first step in management of stroke is typing it. Which one am I dealing with? Is it ischemic or hemorrhagic? Is it the type that is blocked or the type that broke? That's the first thing. The moment you find out what it is, immediately know what to do to bring you back to what you used to be for you, or to bring your father back, or whoever it is, regardless of their age. You go to the hospital, depending on how busy the place is, depending on the country you're watching us from. You're going to be there, 3 hours will pass. But they won't find out that you had a stroke. Because there are other people who are having, you know how triage, what we call triage medicine is. You're in a space where the ratio of doctor to patient, it overwhelms the system to where sometimes you can sit with a very serious emergency and the emergency will tell you to after 8 hours because there are other more serious emergencies that also present. But if you have this knowledge before anything like this happens, you know where to go to first. Scan. Before you even see doctor. If you can help yourself, help your family members, take that patient and go and write it down. Bring that, let me say it now. Go and bring that, wait for you small. Of course, you can pause the videos. I don't need to wait for you. Non-contrast CT brain. That's the name of this one. Non-contrast CT brain. What are you having? Well, somebody can go and do it. That is what will determine whether or not you will go back to what you used to be. If you have this accident, we call it cerebrovascular accident. So the word accident tells you can choose anybody. Nobody, whether you're president, whether you're slim, whether you're fat, it happens to anybody. Even sometimes the offender in blocking the vessel, first of all, is a blood clot. It's not even all those other things you'll be thinking, I'm not fat, I'm not slim. It happens to anybody. The offender is blood clot. The same thing happens when you wound and the blood drops on the floor and it dries. So if blood dries inside the pipe that's carrying blood to the brain, the thing can't get to the brain again. The thing will show me sign that something happened. Or the blood vessel that's carrying blood to the brain breaks. If it breaks, blood doesn't get to the brain. Sign will come. But the signs we see clinically, we can only guess. Is it this one? Is it this one? And time is going. We are giving you, okay, let us give you. Listen, it's not. You see, okay, that is what we're doing. Why not save us all this? Come with your CT result. Sir, this bad man 2 hours ago is what happened to you. But don't see it. The doctor will be amazed. The doctor will feel like, and then everybody's doing it. And everybody comes back after this type of accident. That's what we want. So this is not one of those videos you watch and leave. Or any of our videos, most of our videos are very repetitive. Share. Don't watch and leave it. Like somebody say save message. Don't save it. Just send it. Share it. Don't save it. Say saving your phone. Saving it. You save somebody with it, okay. But when you share it, they will save you with it. They've not heard it. Go and send to them. When you're unconscious, you're not the one who's going to make decisions for yourself. No matter how good you are, no matter how excellent you are, no matter how whatever you are, it's other people's excellence that will deliver you at that point, not your excellence. So the earlier you make other people excellent, the better for you. See how we are responsible for each other. I don't like it. Like you're introvert, you don't like people. Then you collapse in your room, they'll break your door down, come inside and help you by force. So better inform them. And you can't teach as I'm teaching, but you can send it to them in their phone and they watch it themselves. When we do a CT brain, it tells us this is the type of stroke that is block type or breaking type. If it's the block type, we give an injection. Ooh, it will break the block. Blood start going, functions start coming back, and with physiotherapy and some other couple of other things, function will come back fully. When it's a type that is broken, we will not give that injection because that breaking, it is the same material that blocks this other type of stroke that heals the breaking on this side or that attempts to heal the breaking. So if healing is already happening for somebody who had a stroke and you go and give the same injection to go and scatter healing that is happening, and you're doing it because you don't know. You're not sure. You don't know. What am I preaching? Go and do scan. What I'm preaching. I call the name, I should call it again. Non-contrast CT brain. Go there, they'll do it for you. Bring results and present. Your father back to normal. You back to normal. Whoever it is, back to normal. Are you hearing what? Are you hearing? Are you hearing?